all of our districts, our school districts, we celebrate Red Ribbon Week, and it's a national celebration of being drug free. And typically it starts October 23rd to the 31st, towards the end of the month. And we really get into this month to really get our education out to our students to help them have better choices and to be drug free. So today we have presenters. Myself, my name is Scott Kaiser, and I'm a program specialist with student services at Twin Rivers Unified School District. We have Jeremy Combs, who is also a program specialist in student services with Twin Rivers. We have Joanna Ramirez, who is a program coordinator for Lucha Tobacco with Health Education Council. And we have Christopher Serra with Omni Youth Programs, and he's an outreach director. So all of us will be presenting on different capacities today. So we wanted to share this information with you. So the information that we're going to go over, obviously, is Red Ribbon Week. We'll kind of talk more about that. We have district resources and services that we'd like to present to you guys. If your children or there's other children out there that may need support, friends of your children, of your students. We will be talking about e-cigarette and early identification and conversation starters, and tips and techniques to keep students drug free. All of this work is supported by grant funding through the Tobacco Use Prevention Education Grant. And really it focuses on allocating money to school districts to provide resources and services to youth to prevent tobacco, alcohol, and other drugs for their future, for a better future for them. So kind of a background about Red Ribbon Week. It began in 1985 following the death of DEA drug enforcement agent Enrique Kiki Camarena. And he was basically captured in a undercover operation by the cartel and was killed during the line of duty, or in the line of duty. And he was obviously, he put his life towards fighting and battling the war on drugs, and he was killed for that. And so in celebration of Kiki, starting in 1988, we started the Red Ribbon Week celebration, and that's why you always see the red ribbons in schools, and we celebrate being drug free, and really in theory because of him and all that he did. So what's happening at our school sites? We have a lot of students that are doing outreach, peer-to-peer outreach on their campuses, and really focusing on alcohol, tobacco, and drugs, the harm and effects, the identification, the signs, and the reasons why, obviously, not to get involved. So as you guys can see the pictures, students are a huge advocate and huge asset in this work, because a lot of times students will listen to students more than they will adults. And in this outreach, we teach students how to do that engagement with our youth, so that it's more impactful. Obviously, as we have a lot of other services as well that tack on to support them as a safeguard, but we really found that it's benefit for students to enlighten other students. So really, we wanted to talk to you guys about how to get involved with your youth, with your students, with your families, to increase awareness, how to talk to your children, if they are using, how to encourage them to quit and get help, and then to utilize district supports. And that's kind of what we're going to go into right now.
My name is Jeremy Combs. I'm a program specialist also with Twin Rivers, and I'm going to be talking with you guys today a little bit about the services that we offer through the TUPE grant, which is Tobacco Use Prevention Education. We're going to be going over the prevention curriculum that we offer at the district, as well as some of the youth development activities. As Scott mentioned, we do a lot of those activities kind of kick off with Red Ribbon Week through our programs. Some of the pictures you saw there were some of our clubs and different outreach that we'll be discussing. We'll also be going into the intervention programs that we offer for students in our district, as well as cessation resources that are offered to the students as well. And new to this grant this year, we have the family and community engagement component, which is why we're here tonight. So we're excited to be here to share this information with you. The next slide, please, Scott. There we go. Oh, it's back. Okay, so before we jump into the services that we offer, we want to give you a little bit of a background about why we do the work that we do and what we're seeing trends in our district. So the graphic that you see here goes back to 2014-15 as far as when we did not have the TUPE grant, and then looking forward to see, since we've had the grant, what we've seen as far as the effectiveness of the interventions and prevention services that we offer students. And what we noticed, as you can see from 2015-16 to 2017-18, we had a huge reduction of tobacco and e-cigarette use. But then in 2018-19, we had an increase again, which can be attributed to the rise in vaping and e-cigarette use with students. So a lot of our trends last year, unfortunately, with COVID, we did not have as much data just due to the amount of students. The referrals typically happen from in a school setting, so we weren't able to capture as much data. But I can tell you from what we have already this year, we've definitely seen a trend in usage, definite uptick in the month of September, which typically we've seen that later in the school year. So, we can attribute this to a lot of different things, just a lack of connectedness in schools or with students. So, and, peer influences, different things like that happen when students kind of get back together. So the programs that we put in place really help to combat the use of all these substances. Next slide, please. So we're just going to talk a little bit about some of the prevention curriculum that we offer to your students. So most of the prevention curriculum that we do offer is grades 6 through 12. Starting in 6th grade, we do a program called Catch My Breath, which is to vaping or a nicotine vaping prevention program. Typically, these are all in all of our 6th grade classes. Some sites have already started this. They do it at different times throughout the year. So your student may or may not have already began this, but we do know we implement them at all of our sites. Next slide, please. So the next one is Project Alert. This is offered to all 7th and 8th grade schools. So Project Alert is about 11 lessons for 7th grade and 8 booster lessons for 8th grade. In 7th grade, the topics, they can range, they go over, tobacco, vaping, alcohol, marijuana use. So it goes into refusal skills, a lot of different lessons there targeting about, helping students make better choices. And then once we reach high school, which is our next slide, we're doing the Stanford Prevention Toolkit, which is through Stanford Medicine. The curriculum was offered starting last year for 9th grade students. We try to roll this out in health class, but so it can be 9th grade, but it can be all the way up to 12th grade students. So all of our high schools in health, we kind of provide this curriculum to all. And when we started it last year, we ended up doing it more as a remote self-paced curriculum. There's a lot of standards that have to be fit in that small window of time for health. So teachers do reinforce some of the concepts, but most of the majority of the lessons that are being offered are online. Students will work on that at their own pace. Next slide, please.
And we also have a curriculum for high school students who may be pregnant or parenting. It's called Tobacco-Free Generations, and it's taught at Pacific High School. And the teacher there, it's through a child development and life skills course. So there are students in there that actually aren't pregnant that want to learn more or want to get in the medical field, or child development field, which is also awesome. So we offer that too. But really it's intended for pregnant parenting teens. And Pacific has a daycare center where students can still go to school and have their children go to the daycare at school and still be productive and still get their education. So this is taught during the year. There's 2 semesters of the child development and life skills class, so it's obviously taught in both semesters. So if there's any families out there that are in need or who are struggling with early childhood pregnancies, they can always go to Pacific High where they offer those resources.
Thanks, Scott. So in addition to those, we, like I mentioned, offer the family and community engagement outreach, which this is kind of our kickoff to that as well. and some of the lessons that we are going to be covering later in the year. So Thursday, November 4th, will be the beginning of the workshop series, which will be hosted by Health Education Council, and it's entitled The Conversation. It's really looking at how to have that conversation about vaping and other drug use with your child. We'll be touching on a few pointers today, but this really dives deeper into the subject and allows you to, ask more questions, have more examples about, the best ways to have those tough conversations sometimes with our students. And then Thursday, November 2nd, Omni Youth Programs is going to be hosting a series, Marijuana 101. So there's a lot of just information about, the facts about the usage, especially with teens, and just looking about resources and resisting peer pressure. And I'm sure Health Education Council and Omni Youth can go to a little more detail. They'll also be presenting today to give you guys a little bit more information. Well, next slide, please. Great. So in addition, like Scott was mentioning before, with our Red Ribbon Week and then other programs we have throughout the year, we partner with Sacramento County Office of Education to offer Club Live and Friday Night Live programs at our middle and high schools. These programs really focus on youth leadership. They focus on just empowering students really to learn about and design programs that really encourage positive peer influence and provide opportunities for them to build skills and advocate issues that are meaningful to them. But the main focus is looking at preventing drug and alcohol use. And a lot of the projects they do are, within the community, within the school, and there's also a peer education component to that as well. The mentoring programs typically are held at our Foothill High School location and Rio Linda High School, where we have mentors at those two sites that go over and work with students in the junior high, so at Rio Linda Prep and at Foothill Ranch. So those are the mentees that they kind of help support. And then school site leadership is really impactful with keeping those programs really emboldened and trying to really partner with those leadership classes to offer these programs that we have students participate in. We're actually going to skip the leadership video that we have right now, just for the sake of time. We will share the link in the chat. So this is just an example of the program that it's Friday Night Live, which is the high school program version of that. And like I said, for the time being, we'll hold off on that, but we'll share a link so you can see it. It's about a 2-minute video, and it really just shares the students' experience with the program.
And if your students, or if you're interested in getting your students involved into prevention and outreach at the middle school and high schools, you can feel free to reach out to us or send us an email. We'll have the contacts later on. But it's a really good program. It's really good for putting on resumes for your students for the future, for work. So it's a very, very good developmental program that instills leadership and responsibility, stuff like that. So for intervention services, so let's say, for example, there are students that or your student that may be experimenting or trying, alcohol, tobacco, or drugs. You can definitely reach out to us. We offer a program called Brief Intervention Teen Intervene, and we can utilize this program in lieu of suspension at schools. Some administrators feel that it's better to utilize a restorative practice instead of suspension, and have the students learn. So what they do is they do like a 3 counseling sessions with us, and we include the parent guardian in these sessions to help them understand the harm and effects, and to really quit the cessation of what they're using. And we have the parent guardian involved in the 3rd and final session to get them to support them and how to support them in the future. So the referral process typically works, like Jeremy said, at the school sites. It's identified at the school, whether it's a soft referral where someone says, hey, I'm worried about my friend, or a teacher or a counselor is saying, hey, I'm worried about the student. They can refer us to that student to support. And we obviously contact the parent to offer those resources. Obviously, there could be an infraction where students have alcohol, tobacco, or drugs on campus, and they get referred by an administrator. And we would then provide the brief intervention. And depending on the situation and how intense their use is, or if they're addicted, we can go different avenues with different resources and offer a different path depending on their situation. So that's kind of what it looks like. That's how the intervention referral process kind of looks like. It could be a health services staff member, counselor, administrator, and they always contact myself or Jeremy, and then we get them the services they need. Jeremy? Mute.
Yep, there we go. So some of the programs that we offer are around cessation. We typically refer students in intervention to these programs if they're still having issues with quitting or just want additional resources. Our interventions typically take place in about 3 sessions. So if they're still struggling with use, this is the new version of what was formerly called California Smokers Helpline. So students can call, they can chat, text. There's different ways to access the information, and they have, the people on the other line are trained to help students, talk through what their usage is, and then offer them, different pathways to help them quit. And the other resource we have is Why Vape, which is a newer one that we're going to be starting to refer students this year. So like I said, it's a new resource that was brought through the overall TUPE program. Based out of Orange County, they're actually supporting services statewide. So this is one of the other resources they offer.
All right, and these are our contacts. So feel free to reach out to us if you have any questions about any of those services or resources. And if you need support in working with your student, whether it be just parent information or obviously in the next presentations, you will hear on how to work with your child too. But if there's questions about the services or resources, feel free to reach out to us. And we have that right there for you. Thank you so much.
Yeah, thank you.
And we're going to pass it on over to Joanna Ramirez with Health Education Council and Lucha Programs.
Thank you, Scott and Jeremy. So my name is Joanna Ramirez, and I'm with the Health Education Council. And my organization is a nonprofit whose mission is to cultivate health and well-being in underserved communities by leveraging the power of collaboration. And the program that we are bringing this information to you today is Lucha Tobacco, and Lucha stands for Latinos Unidos contra el Hábito y Adicción al Tabaco. And our program offers workshops, trainings, and assistance for school staff, for clinic staff and health professionals, as well as for parent and community groups like Twin Rivers that we're doing today. So next slide. So the evolution of tobacco smoking products. So we're going to talk about the various different tobacco smoking products that are out there in the market. And as we've seen, they do continue to evolve. They started out as traditional cigarettes, and now we have the different e-cigarettes and vaping products. And within those categories, there's, multiple different shapes and sizes and types of those. So we know that they are becoming more popular among youth. And that youth are more likely than adults to use e-cigarettes. And in 2019, 18.2% of high school students in California, they used electronic vapor products on at least one day in the past 30 days. And nearly 200,000 high school students currently use cigarettes and other tobacco products. So their use and popularity is definitely on the rise with the youth. Next slide. So e-cigarette use among youth, e-cigarettes and vaping, they have threatened the years of progress made towards social norm change. It was thought that, this younger generation was thought to be the ones to end smoking, but now with all of these newer products in the market, e-cigarettes and vaping products, now younger people are using these products, and then it's easier for them to move on from these e-cigarettes to traditional cigarettes and then other drugs. So it's definitely, these products have really put back, the use of cigarettes and nicotine products. And In 2020, 19.6% of high school students and 4.7% of middle school students, they reported e-cigarette use. So this number is lower than 2020, if you can see on that graphic on the screen, but it's still, a troubling number for the youth to be using these products. Okay, so right now we're going to show you guys a picture of some school supplies, and we want you guys to identify how many tobacco products you see in this picture. So just, however many you see, you can count them. So we know that there are many different types of e-cigarettes out there in the market for teens to use, and they are becoming smaller and easier to hide. And they do come in various shapes and sizes, as you can see in this picture. And we can go ahead and show how many there are. Yeah, so there's, I'll tell you guys, just so you guys don't have to count the circles. There's 17 different tobacco products in this picture. So as you can see, there's many different shapes and sizes and colors, and they can easily blend into other school supplies that your kids may have. Okay, next slide. So there are many different types of e-cigarettes out there. And most have a battery and a heating element and a place to hold a liquid. And some e-cigarettes are made to look like regular cigarettes, cigars or pipes. And then there's others that resemble pens and USB sticks and other everyday items like we just saw in that image in the previous slide. And e-cigarettes can be used to deliver marijuana and other drugs and not just the nicotine products. So here are just some examples of the closed system and refillable open systems, and then there's disposable types of e-cigarettes as well. And they're consistent with 2019 data, pre-filled pods or cartridges and were the most commonly used device type in 2020. However, during the 2019 and 2020, disposable e-cigarette use increased approximately 1,000% among high school current e-cigarette users and approximately 400% among middle school current e-cigarette users. So the most popular types are the disposable types of e-cigarettes. The next slide. So hooking youth with flavors. So what is the attraction to e-cigarettes? Tobacco companies know that flavors attract youth, and that they exploit this by selling over 15,000 types of flavors for e-cigarettes. And 80% of tobacco users start using before the age of 18. There's many reasons, and one of them, and over half of them start with menthol cigarettes, since this is the most popular and common flavor that these products are sold in. And youth cite flavors as the top reason for using e-cigarettes. And 97% of youth who vape use flavored products. And among high school students who currently used any type of flavored e-cigarettes, the most commonly used flavor types were fruit, mint, and menthol. And among middle school students who currently use any type of flavored e-cigarettes, the most common flavors were fruit, candy, desserts, and other sweets. And lastly, it was mint. So we know that youth really like the flavors, and that's the reason why they use these products. Next slide. So flavored tobacco and vaping. So a little bit more about this. We know that flavors do play a significant role in enticing youth and young adult to use these products. And the industry has definitely targeted kids with sweet and candy flavors to mask the harsh taste of tobacco. And 80 to 85% of youth say that their first tobacco product was a flavored product. And some of the flavors include menthol, horchata, bubblegum, chocolate, and more. And there are over 15,000 types of flavors available in the market. So we know that there's a lot of different options for them. And there is a flavored tobacco ban, SB 793. And this bill bans the sale of menthol cigarettes and all flavored e-cigarettes statewide, as well as flavored non-cigarette tobacco products like smokeless tobacco and some cigars. And this law hasn't taken effect yet. It's going to be voted on by the state's voters on the next ballot in November 2022. And we know that there is a vaping epidemic in the United States, and that youth are more likely than adults to use e-cigarettes. There have been 204 vaping-related deaths, and out of those, 4 were reported in California. Most of the cases are from males, and their ages range from 14 years old to 70. And most use THC, but some vape only nicotine. And in 2020, 3.6 million US middle and high school students reported using e-cigarettes in the past 30 days, including 4.7% of middle school students and 19.6% of high school students. Next slide. So there are a lot of unintended consequences by using these products. The e-cigarette aerosol that users breathe and exhale from the device can contain harmful and potentially harmful substances like carcinogenic heavy metals and ultrafine particles that can be inhaled deeply into the lungs, as well as nicotine. And there have been some e-cigarette battery explosions with defective e-cigarette batteries. And one of the biggest consequences is that youth are more likely to try cigarettes, marijuana, and other drugs after they start using an e-cigarette or vaping device. And are e-cigarettes really safer? We know that vaping may be less harmful than smoking, but it's still not considered safe. And we've seen that with the outbreak of lung injuries and deaths associated with vaping. And research suggests that vaping is bad for your heart and lungs. And e-cigarettes are just as addictive as traditional cigarettes because they do contain nicotine. And the nicotine in one vape pod is equal to 1 pack of cigarettes. So we know that this new generation is getting hooked on nicotine that's contained in these products, and then they're more easily susceptible to moving on to other products. Okay, so now we're going to go over some tips about how to have that conversation with your child about using tobacco products. So these are just some guided tips on how to go about the conversation, and we'll be going more in depth on how to go about the conversation and some more tips and conversation starters for our next workshop. But just for starters, the main ones you want to ask them, you want to ask your child what they know about smoking and health. And then next, you want to tell them some of the tobacco industry's marketing and myths. And then next, you want to remind them that all tobacco products, even the smokeless ones, contain nicotine and can cause addiction. And then you want to share resources for their own research and explain how it's much easier to say no in the first place than to quit later. So we'll be going more in depth on how to have this conversation with your kids in next week's workshop. And then here's some resources to share with you guys, and we'll be sharing them with you through email. And I think it's just my contact info. And then we'll be handing it over to Chris.
Hey, thank you. That was awesome. Just kind of even piggyback a little bit off of some of those tips and techniques that Joanna just shared. But again, I'm Chris. I'm with Omni Youth Programs. You can go ahead and go to the next slide. And we've been around since 1979. Our mission is to help create strong families, develop youth leaders, and engage the community to prevent youth, alcohol, marijuana, and other drug use. And we get all of our funding by the county. So that we're able to offer this program and all of our services for free to anyone in the county. So excited to share with you guys today. You can go ahead and go to the next slide. So one of the biggest reasons you're here talking about drug and alcohol prevention and tobacco prevention is because addiction starts early in life. It starts very young for teens. And today we have the highest use of marijuana in teens in a long time. And that has a lot to do with something that Joanna touched on, is that normalization. The more that a young person or anyone in general believes that there's a risk to using, the more likely that they're not going to use. And whenever that risk goes down, people are going to be more likely to want to try it. So it's kind of a thing where with legalization, it's kind of created this idea that marijuana is not harmful. And in our presentation in December, when we talk and have our session, then we'll really dive into and kind of get into more of the numbers and talk about the difference in THC levels. But one of the things that I want to touch on real quick is that marijuana THC level, which is the part of the marijuana that gets you high, in the Woodstock days was maybe like 0.5% THC. Well, now average marijuana has about 28% THC. And if they're using vapes, vaping products to use marijuana, then that can be up to 98% THC. So it's way more potent. It's an entirely different drug. That's why in our presentation we talk about it's a different drug from days before. And we'll dive more deep into that later on in our presentation in December. But one of the awesome things that I like to share is that we've done tons of surveys with students, with young people over many years, and the greatest influence in their life is their parents and the people around them. It's not the popular things on TV. It's not whatever else is going on around them. The biggest influence in their life is their parents. So you guys as parents who are watching this today have the biggest impact to help your students to stay away from drugs. So I'm going to give you a couple tips on how you as a parent can help keep your kids safe from drugs. We can go ahead and go to the next slide. Again, this is just showing that perceived harm. So you can see here, whenever the perceived risk was up, the usage rates were down, and the opposite is true as well. Go ahead and go to the next slide. So the first tip I want to share with you guys today is ask without asking too many questions. Just ask your students about their life. Ask them about the people around them, who they're with. Ask what they know. Something Joanna touched on relates here too. What do they know about marijuana use or drug use or any other drug use for that matter? Or do they know anybody at their school that's using? And the biggest key here is to listen. Listen as much as possible. Listen to what they're saying, how they're saying it, and try to be listenable. Be someone that your student wants to talk to, and that goes into the next slide. Become the askable parent. Become that adult that your children and their friends want to come to. Not saying that you have to be their buddy, their best friend, but be somebody who allows your student to talk, allows them to share without feeling like I can't say anything without getting in trouble, or I can't share what my friends are doing without you thinking that I'm doing it. But be that person that is able and open for them to talk to. The next one, please. Get to know your child's friends, especially their new friends, right? Know who your kid's hanging out with. I know my parents always knew everybody that I hung out with. And the second they didn't know someone, they like, oh, why don't you invite Jimmy over for dinner? Because it's important to know who your kid is associating with. They might not know that this person may not be the greatest influence for them. But a lot of times you can tell. Parents have been around, right? We know a little bit more sometimes. And we can kind of encourage them to hang out with other people, or again, just to know, okay, if he's out with this person, I might want to be a little more alert of the situation. And then at the same time, getting to know your friend's parent, your child's friend's parents, getting to know them, not in a judgmental way, but just so you know that who they hang out with. Are these parents that maybe don't have as strict rules in their household as you do? Is that going to be a concern if if your son goes over there or your daughter goes over there? Is that going to be an issue? So definitely want to know who your kid's hanging out with. Next slide, please. Offer to drive your teen and their friends places. This is the ninja spy move right here. Just, hey, if your kids want to go to the mall, if they want to go to the movies, whatever they want to do, say, hey, I'll give you a ride, no problem. yeah, make sure it's okay with their parents, and I'll drop you guys all off. And again, just be that spy, that ninja in the background as you're driving. What are their conversations going on about? Who are they talking about? Maybe they're talking about who they're going to meet at the mall, and you go, well, I've never met this person you guys are talking about. Again, getting to know who your kids are hanging out with, and just kind of being knowing what's going on in their lives as much as you can, without having to be nosy and going through all their stuff and making them feel uncomfortable, but making them feel like you care. Next one. And the last one is always know your child's plan. Again, who are they with? What are they going to do? Where do they plan on being? Are they going to go to this store? And then maybe they're planning on going to another store across the street or down the block. Obviously, if it's in the same area, you don't need to know all those little tiny details, but you want to know where your kid is at and when they expect to be home. Setting clear guidelines and clear boundaries is super important for you as a parent and your child as well. Next slide. So this week we have a couple of really cool things going on. We want to make sure that we participated in Red Ribbon Week as much as we could. And so tomorrow we have a mental health hacks for teens. Again, a lot of our teens have been under a lot of stress this past year, and even transitioning back into school. So we're going to have a Facebook Live event tomorrow on our Facebook page, and we'll give you the details later on. But there's going to be a mental health hacks for teens on Facebook Live tomorrow. And then on Wednesday, there's actually going to be a free webinar. You do have to register for that one. But that one's just 9 strategies for teens to kind of help them. So it's kind of a continuation from the Facebook Live. And then we do have a Family Matters training program going on this week. So maybe you're somebody who wants to help out other families in your community. This is a program where you can get trained. It's 2 days, this Thursday and next Thursday, where you can get trained by us to lead a program for other parents, for other friends, for other family members that you might have. And we'll give you the opportunity to learn how to lead it and to be able to lead it. And then actually, if you end up leading 5 families through the program and they complete it, you'll get an opportunity to earn a $200 Visa gift card. So it's a really, really cool program. If you're interested in any of these, feel free to reach out, or I see Hitbet, they'll put in the links there below. And that's everything I have for you. Again, that's our Facebook and our Instagram, and you can see that's kind of where we put a lot of our upcoming events and announcements.
Awesome. Thank you, Christopher. A lot of great information, and parents, please take advantage of that and those opportunities and those trainings. Great program. Definitely benefits our communities and our students and our youth. And obviously you can get reimbursed for that, like Chris was saying. So thank you, John, as well, from Lucha Tobacco and Health Education Council. Thank you, Jeremy. Thank you, Edberto, as well, and all the translators.